So hi guys, I'm here with Dr. Tony Hampton.
The Dr. Tony Hampton.
The Dr. Tony Hampton.
Oh my goodness.
You know I have a crush on you, right?
Oh yeah.
An intellectual
is
crush.
this going like on YouTube? Because my wife's gonna see this.
Yes.
Okay. Okay, we'll be okay.
Awesome. So you were here, one of the speakers,
Yes.
and your talk was about.
Well, it was really about the importance of when I have a patient in front of me, how do I approach that patient, right? And I talked about the importance of not just teaching low carb and carb restriction and things like that. I talked about sometimes you need to know why they may struggle. So when I'm dealing with patients, I'm always trying to brainstorm. So when I came up with this N.E.S.T and wrote acronym, the nutrition, exercise, less stress, more sleep, how we think, that stress and sleep is something I have to think about. And,
Yes.
and I don't just think about the acronym and the various components, like the rope talks about relationships and other stuff. I look at, do they have access to good food, right? Do they have transportation issues? So when you have somebody in front of you, whether it's a family member, yourself, you should expect them to struggle, and your job as a family member or for yourself to figure out how to overcome that struggle. So if you're struggling with transportation, tell your health system, I'm struggling with transportation. If you don't have access to good food, talk to your health system or your community about where can I get access to good food. And if you break those barriers, then you'll have a better chance to be successful. There's nothing wrong with you. What's wrong is that our system is not supporting you. And your job is to let the system know what's wrong so they can fix it, and you guys work together to make that happen.
So basically, you see the patient, you don't see the disease, you don't see the numbers, the A1C. You help the whole patient.
Yes, I see the whole package.
Because what we know is success on a diet is 80% diet. Success on keto, you want to address sleep, stress,
Yes.
all these struggles, all these areas.
Exactly. In fact, that 80% is really about what are the things in your environment that are making you struggle. Like you can come to a conference like Keto Pa-Louza and you can learn concepts, but what you need to really focus on is how do I make sure it's safe for me to take a walk in my neighborhood? Or maybe I just don't walk in that neighborhood and go somewhere else. So you have to think outside the box and be creative, or maybe I just exercise in my house. Those are the things that are going to be important, and if we can help people achieve those goals and break those barriers, they're going to be successful. They need somebody to coach with and walk with them. I know you're a coach.
Yes.
Amen. They need somebody to walk with them and kind of hold their hand and then encourage and support them while making them accountable.
Yes. Awesome. Thank you for this interview.
Absolutely.
And we'll do another one soon.
Well, let's keep doing this. I appreciate you. Thank you.
Perfect.